Hello, everyone. Thank you for viewing this informational Medicare education event. My name is Carrie Buckley, and I am with the Buckley Insurance Group, and I am here to go through with you all aspects of Medicare education. We're going to start with the enrollment periods and how to avoid penalties, and we're also going to cover each part of Medicare, what it covers, what it doesn't, and then the options that you have to pick up the pieces that Medicare doesn't cover. So first, let's talk about when you sign up for Medicare. There are a few times that you are able to sign up for Medicare. The first is through your initial enrollment period. And your initial enrollment period is when you are turning 65. If for any reason you missed that initial enrollment period, you do have another opportunity to sign up for Medicare during the general enrollment period. And that general enrollment period runs every year from January 1st to March 31st. However, if you do sign up during the general enrollment period, you would be subject to a penalty. And then there are other times during the year that you would be eligible, which are called special enrollment periods. And those are when you have special circumstances, and that provides you with a time frame to sign up for Medicare. And we're going to go through these, okay? So first, let's talk about your initial enrollment period. Your initial enrollment period begins 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. So if you know that you're going to go on to Medicare when you're turning 65, you don't want to wait. You want to get your enrollment done the 3 months before your 65th birthday. Medicare eligibility starts the first of the month of your 65th birthday, unless you defer Medicare, and we'll get into that a little bit later. So for example, if your birthday is on July 22nd, Medicare A and B will start on July 1st. Now, if your birthday is on the first of the month, Medicare A and B will be effective the first of the month prior. So Medicare, if your birthday's on the first of the month, Medicare gives you a whole nother month of eligibility. So for example, if you're turning 65 on April 1st, your Part A and B effective dates would be on March 1st. So if you're turning 65 and you know you want to go on to Medicare, how do you sign up? Well, there's a few ways that you can sign up. First, if you're collecting Social Security already, enrollment in Medicare is automatic. So you are going to be automatically enrolled in Medicare Parts A and B, and you will receive that card about 3 to 4 months before your 65th birthday. If you're not currently collecting Social Security, you can enroll a few ways. You can call Social Security to schedule an appointment, and that's at 1-800-772-1213, or you can sign up online at ssa.gov. So let's talk about Medicare. This is your red, white, and blue Medicare card. So when you're enrolled in Medicare, you will receive this card. This card will have your name on it. It also has your unique Medicare ID number, and it lists the dates that your Parts A and Part B became effective. Now, Medicare is made up of a few parts. It's made up of A, B, C, and D. And we are going to go through each of those parts, explain what they cover, what they don't, and then again, the options that you have to pick up the pieces that Medicare doesn't cover. So once you get this card, you do want to keep it in a safe place. If you have a Medicare supplement plan, you will want to carry this card in your wallet, but you should keep copies in a safe or in a very safe place in the case that you lose the card. Okay, so first we're going to go through Part A, Medicare Part A. Medicare Part A, as long as you and or a spouse have worked 10 years or 40 quarters and paid into Medicare taxes, Medicare Part A is free. And what Part A covers is inpatient hospital and inpatient skilled nursing. So the first 60 days of inpatient hospital under Part A is covered at 100%, and the first 20 days of skilled nursing is also covered at 100%. However, if you only have Part A, there is a $1,600 deductible per hospital occurrence. That's only if you have Part A by itself. Medicare Part B is your medical. So that is anything not inpatient hospital. So that would be doctor visits, lab work, x-rays, ambulance, emergency room, outpatient surgery. And Medicare Part B is not free. Medicare Part B is based on your income. And we're going to get into the cost for Medicare Part B on the next slide. But what Part B covers is 80% of your medical expenses. And there's an annual deductible of $226. So let's talk about that Part B premium. So Medicare will do a 2-year look back in the year that you are going to go on to Medicare. So for example, if you're going to enroll in Medicare in 2023, Medicare is going to do a 2-year look back at your 2021 tax return, and they are going to look at your modified adjusted gross income from that 2021 tax return. And that's how they determine the Part B premium. So if you are married and your joint modified adjusted gross income from your tax return was $194,000 or less, or if you're single and your adjusted gross income from that tax return was $97,000 or less, your Part B premium will be $164.90 a month. Okay, now as you can see, the higher your income, the more your Part B premium will be. Okay, so depending on what bracket you fall into here, that is what your Part B premium will be. Now, in addition to the higher Part B premium, if you fall above that $164.90 range, not only do you pay a higher Part B premium, but you also have a surcharge on your Part D prescription plan as well. Now, how do you pay your Part B premium? Well, if you're currently receiving Social Security, the Part B premium will be automatically deducted from your Social Security check. If you're not currently receiving Social Security, you will be billed quarterly for the Part B premium. Now, if there was a situation where, let's say, your adjusted gross income in 2021 was higher, so let's say you're going on to Medicare now in 2023, okay, but you retired in 2021, and in 2021, your adjusted gross income was $500,000, okay, but in 2022, you retired, and now your adjusted gross income has fallen below that $194,000. Because of the significant life event of your retirement, you can then appeal your Part B premium determination. Okay, so if your income has changed in that 2-year look back window for a significant life event, you do have the ability to appeal the Part B premium determination based on that life event. So what you don't get with A and B. So Medicare Parts A and B are also referred to as original Medicare. Okay, and what A and B or original Medicare don't cover are dental, vision, prescription drugs, hearing, and help with long-term care. Now, when we talk about vision, we are talking about routine eye exams, lenses, or frames. Okay, if it's a medical condition of your eyes, like macular degeneration, glaucoma, cataracts, that is covered under your Part B medical. But A and B do not cover the routine eye exams or frames or lenses. Let's talk a little bit about delaying Medicare Part B. So if you or your spouse are working and you are currently covered under one or the other's group employer insurance, you may be able to defer Part B depending on the size of the employer. So the general rule of thumb is that companies that employ 20 people or more usually will let you defer Medicare Part B. And companies of 19 or less usually require you to enroll in Medicare Part B. And again, that is just a general rule of thumb, and this is when you're turning 65. So we always encourage you when you're turning 65, if you plan to be covered by either you or your spouse's employer insurance, that you check with the HR or benefits person to see if they require you to enroll in Medicare Part B or not. If they say you can defer Part B, then you can absolutely do that, and you can continue working and defer Part B for as long as you are on that group coverage. Now, a few things. If you are contributing to a high deductible health savings account, okay, and you're going to continue on that, you do not want to enroll in Medicare A or B if you're allowed to defer, okay, because there are certain tax implications that arise when you have Medicare Part A and you're contributing to a high deductible HSA or health savings account. And if you'd like to get more information on those tax implications, you can certainly either reach out to us. We have a link we can send you on articles, or you can speak to your accountant about that. Now, if you can defer Part B, there is no loss of options when you decide to come off of your employer insurance, and you will not receive a penalty because you have had creditable coverage through an employer. So let's say you're turning 65, you're on employer insurance, and you're collecting Social Security. Well, you are going to be automatically enrolled in Medicare Parts A and B. Okay, so if your employer group coverage says that you can defer Part B, then what you do is when you get your red, white, and blue Medicare card in the mail, you will sign the back of the card and send it back to Medicare. That will let them know that you do not want Part B at this time, but you will keep your Part A enrollment. And you do need to have A set up in order to get B later on down the road. So there's no harm in having Part A set up, even if you're deferring Part B, again, unless you are contributing to a high deductible health savings account. Okay, so now we talked about Medicare A and B, what they cover and what they don't, right? And just to review that, Medicare Part A is your inpatient hospital coverage and inpatient skilled nursing. And with Part A by itself, there is a $1,600 deductible per hospital occurrence. And with Medicare Part B, it covers 80% of your medical expenses, and there's an annual deductible of $226. So those two deductibles and the 20% that Part B doesn't cover are left to you to figure out whether you want to just pay for that out of pocket, or you can pick up some other types of coverage to pick up those pieces. And there's basically three roads that you can take. You can either go onto a retiree or union plan if that is eligible for you. If you're not eligible for a retiree or a union plan, you can either take a Medicare supplement plan or you could take a Medicare Advantage plan. If you are eligible for a retiree or a union plan, you do want to ask some questions. You want to know, are there copays and deductibles associated with this plan? Does it include prescription coverage? If you opt out now, can you opt back in later? What is the cost of the retiree or the union plan? And does it include dental and vision coverage? So basically, if you're offered a retiree or a union plan, it makes sense for you to compare the costs and the benefits with just going on to Medicare and picking up a supplement or an Advantage plan. So you're going to definitely want to do a comparison to see what would be the most cost-effective route and the route that offers you the most coverage. Now, just a little note, retiree coverage in some cases is not considered creditable coverage if you are delaying enrollment into Part B. So if you are going to remain on a retiree or union plan, most of the times you have to enroll in Medicare Part B, and you are going to want to check that with the group benefits person. So if a retiree or a union plan is not an option for you, the other two roads that you can take is either a Medicare supplement plan or a Medicare Advantage plan. And we're going to go through both of these roads. Now, whether you take a supplement plan or an Advantage plan, you need to have parts A and B. Okay, so whether you take supplement or Advantage, part A and B have to be active. And these are the plans that pick up the pieces that Medicare doesn't cover. Before we get started and we talk about the supplement and the Advantage plans, I do want to just tell you all that Medicare is not one size fits all. It's a very individual decision. Okay, so what worked for your parents or your neighbor or your brother may have worked for them perfectly, but it might not be the best road for you. So you really have to take an individual look at your needs, your budget, your health, and decide which of these roads makes the most sense for you. All right, so let's start with Medicare supplement. Medicare supplement plans are also called Medigap. Those terms are interchangeable. Okay, so with a Medicare supplement plan, these plans are federally standardized Medigap plans, and they're offered in all the states and Washington, D.C. Now, there are 8 plans which are lettered A through N, which are offered in most states. And all of these policies offer the same basic benefits. Some plans offer more coverage, some offer less. So when is a Medicare supplement the best path? Well, with a Medicare supplement or a Medigap plan, Medicare stays your primary insurer. And that means you can use any doctor, any hospital, anywhere in the United States that accepts Medicare. There are no networks and no referrals. So as long as a provider takes Medicare, they will take your supplement regardless of what carrier it's with. So when is a Medicare supplement or a Medigap plan the best path? Well, if you want to budget medical costs. On a Medicare supplement plan, you will always know exactly what your out-of-pocket costs are going to be. If you travel and may need to see a doctor away from home, Medicare supplement plans are very good plans because they can be used anywhere in the United States. If you want to be able to see any doctor or specialist with no referrals, these are the plans that are the better option. So these plans help pay some of the healthcare costs that Medicare does not cover, like coinsurance, copayments, and possibly deductibles. And these plans are guaranteed renewable as long as the premiums have been paid on time. So your Medicare supplement, once you enroll, is automatically renewed each year unless you fail to pay your monthly premiums. So it can never be canceled based on health status or claims. The only way that it will be canceled is if you don't pay your monthly premium. Now, there are 2 most popular and comprehensive Medicare supplement plans. There's Plan G like George and Plan N like Nancy. With Plan G, you would pay a monthly premium. You would pay the Part B deductible of $226. Once you meet that deductible, all the rest of your Medicare covered expenses would be covered at 100%. So on Plan G, it picks up the Part A deductible of that $1,600. So if you're in the hospital and you have Plan G, you're covered at 100%. And it picks up the 20% that Part B doesn't cover after you meet the annual deductible of $226. Now with Plan N, you would pay a monthly premium. You would pay the Part B deductible of $226. You would also have copays of up to $20 when you see a physician and a $50 copay for the emergency room if you're not admitted. Plan N also has something called Part B excess charges. Part B excess charges only come into play when you see a provider that does not accept Medicare assignment, which means they do not agree to Medicare's payment terms. In those cases, they're allowed to charge 15% more than the agreed Medicare rate. So on Plan N, only if you saw a provider that did not accept assignment, you could have some additional excess charges. Now, the excess charges depend on the state that you're in. So if you refer to this slide, the following states that do not allow excess charges are Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. So if you live in one of those states and you have Plan N, you do not have to worry about excess charges. In addition, Plans G and Plan N also offer a foreign travel emergency benefit. So if within the first 60 days of foreign travel, you are ill, Medicare will pay up to what they deem reasonable and customary. They will pay up to 80% of what they deem reasonable and customary expenses after a $250 deductible. And you have up to a lifetime maximum of $50,000 in coverage. Now, very important. All of the Medigap policies offer the same basic benefits. So like we just talked about, Plan G is Plan G and Plan N is Plan N. Those plans offer the same exact benefits. Now, some carriers may offer some additional benefits like gym membership or discounts on vision or dental with their Medicare supplement plans. So it's very important to shop around to see the different carriers and what they offer. The other reason to shop around is that different insurance companies can charge different premiums for the same exact policy. So Plan G with one carrier could be 25% more than Plan G with another carrier. So it's very important for you to shop the different Medicare supplement plans and compare them so you know which plan offers the best rates for the coverage that you want. Now, when you're new to Medicare, you have a 6-month open enrollment period to enroll in a Medigap or Medicare supplement plan without any look at any pre-existing conditions or medical underwriting. Okay, and that's the same thing if you defer Part B for a few years because you have employer insurance and then you join Part B later on, you still have that 6-month window, okay, to enroll in Part B and get onto a supplement without any look at any pre-existing conditions. If you're outside of that 6-month window, so let's say you turn 65 and you take Plan N, all right, and then you're on Plan N for 2 to 3 years, and then after that 2 to 3 years, you say, you know what, I'm going to the doctor more, I don't want to pay these co-pays, or I don't want to have to worry about excess charges, I want to switch to Plan G. Depending on what state you're in, if you want to change Medicare supplement plans, you would have to, at that point, pass medical underwriting. So you would have to answer medical questions on an application, and if you do have any major pre-existing conditions, you could be denied on the Plan G, and that's even within the same carrier. All right, so making your decision in the beginning is important because you may not have the opportunity based on your health later on to change your plan if you wish to. Now, Medicare supplement plans do not include dental or vision or hearing coverage, and they also do not include prescription drug coverage. So you would need a standalone Part D prescription drug plan. Now, you don't have to enroll in a Part D prescription drug plan, but it is recommended because if you don't enroll in a prescription drug plan when you were first eligible, you will incur a penalty for your time not enrolled. And what they do is once they assess that penalty, when you enroll in a Part D plan later on, they add that penalty onto your monthly premium for your Part D plan, and they do that monthly for life. So even if you're not taking any prescription medications, it still makes sense to enroll in a Part D drug plan to avoid that penalty. And there are some very inexpensive Part D plans out there. Now, with Part D prescription drug plans, the prices vary by plan. Okay, prescription drug coverage could be included with some retirement plans, but you do want to make sure that that coverage is considered as good as or better than Medicare's, because if your retirement plan has prescription drug coverage, but it's not considered as good as Medicare's coverage, then if you did go on to a Part D plan later on, you could have that penalty. And if you are a veteran with VA benefits or TRICARE or or CHAMP VA, you're not required to enroll in a Part D plan, but you may choose to do so. And if you do so at a later date, you would not incur a penalty for veteran status. Now, for the prescription drug plans, every Part D plan has a list of drugs which they cover called their formulary. And different plans can cover different medications. So every formulary may be different. And each plan, they take the medications that are on their formulary and they put the drugs onto different tiers. Okay, most prescription drug plans have 5 tiers. The higher the tier, the more expensive the drug. Okay, each Part D plan has a preferred pharmacy network as well, where if you fill your prescriptions at a preferred pharmacy, you will have lower copays for those medications. Now, the prescription drug plans change every year. They change their monthly premiums. They also change the drugs that they cover. So this year, your drug may be a tier 1 on your current plan, but next year it might be a tier 3. But another plan might have it at a tier 2 or a tier 1 for the following year. So every year there's a period of time called the annual enrollment period, which runs from October 15th through December 7th. And that is the time of year to review your prescription drug coverage each year to make sure that you're still on the best plan for the next year moving forward. Now, some of you have heard about the donut hole or the coverage gap. Okay, and I'll explain this a little bit for those of you who aren't familiar. So the donut hole or the coverage gap occurs when you and your Part D prescription drug plan together pay out $4,660 in medication costs. Once you reach that $4,660, you are placed into the coverage gap or the donut hole, where you will pay 25% of the cost of generic and brand name drugs. And 95% of that counts towards your out-of-pocket. When you get to $7,400 in medication costs, then you move into the catastrophic coverage phase after you hit that $7,400. And once you hit catastrophic coverage, then your responsibility for the medication copays becomes much less. Now, if you did not want to take the Medicare supplement with the Part D prescription road, the other road that you can take is Medicare Advantage. Okay, remember, you still need to have Part B in place for a Medicare Advantage plan. Now, these plans also are called Part C plans. You may have heard that term. And what it is that the Medicare Advantage plans or the Part C plans take A and B, Parts A and B, and Part D, and they include it all under one umbrella, which is called a Part C plan. Now, with these plans, what happens is the private carrier becomes your primary, not Medicare. So they work like HMO or PPO plans where you have to stay within a defined network. Okay, so you're basically giving up Medicare A and B. That is no longer your primary. A and B and Part D get put under the Medicare Advantage umbrella, and the private carrier becomes your primary. Now, Medicare Advantage plans, different plans are offered in different counties. So you have to base what plan you choose on the county that you live in. And these plans do include a maximum annual out-of-pocket. So when are the Medicare Advantage plans the best path? Well, if you want to pay a lower premium, the Medicare Advantage plans are usually lower to no monthly premium. You can use these plans as a backup for VA services if you wish to. If you don't mind staying within a network of doctors, these are good plans for you. Or if you're on a low-income subsidy for Medicare, the Medicare Advantage plans may be an option for you. So again, the Medicare Advantage plans are the Part C plans. The private insurance carrier becomes the primary insurer. They offer a lower cost option for those willing to get services within a defined network. And again, these plans are lower to no monthly premium. While they're lower to no monthly premium, what they may have are copays and coinsurance for every single service that you get, including hospitalization. So on these plans, a primary care doctor visit would be one copay. Specialist would be another copay. If you're an inpatient in the hospital, you would have a copay of a certain couple of $100 a day for a certain amount of days, depending on the plan that you choose. Again, you have a maximum annual out-of-pocket on these plans. But for more comprehensive services, like if you needed chemotherapy or injections in your knee, you are going to pay 20% of the cost of that up to the maximum annual out-of-pocket. Now, these plans usually include prescription coverage under their umbrella. Some of them may also offer ancillary benefits like dental or vision, limited coverage, gym membership. Some could offer over-the-counter benefits. Some of these plans do offer very nice ancillary benefits. But remember, there are a restricted number of in-plan doctors or facilities through HMO or PPO networks, and some plans may require referrals. Another thing with Medicare Advantage plans are that with a Medicare Advantage plan, you could be, because the private carrier is the primary insurer, you could be responsible for having to get pre-authorization before you're approved for certain services. So if the doctor tells you you need an MRI, the private carrier would have to approve that MRI or pre-authorize it before you can get that done. Now, if you are new to Medicare A and B, if you're just turning 65 and you enroll in a Medicare Advantage plan, you have a 1-year trial period, okay, on the Medicare Advantage plan. So if for any reason during that first 12-month trial period, you are not happy with the Medicare Advantage plan, or you don't like the Medicare Advantage plan, you can change to a Medicare supplement plan during that first 1 year and without any look at any pre-existing conditions or medical underwriting. If you join a Medicare Advantage plan when you're new to Medicare and you're on it for 2 or 3 years, and then you say, you know what, I'm getting older, I don't know, I don't want to take the chance of having, a major diagnosis where I might have a lot of out-of-pocket on these plans, I want to change to a supplemental plan. Well, at that point, depending on the state that you're in, you may only be able to change to a supplemental plan if you can pass medical underwriting and if there are no major pre-existing conditions. Okay, so again, you want to make the choices when you're first enrolling, base it on your financial situation and your health and what's going to be most beneficial for you. So I hope that this presentation made it a little less confusing. I know Medicare is very daunting. There are a lot of roads to take and a lot of different options that you have. We are always happy to help with any questions that you may have, or if you need our services for any reason to enroll. Again, my name is Carrie Buckley. This is my contact information, and I would be happy to speak with you and answer any questions or guide you however you need. Thank you so much for your time today, and have a good day.